Welcome to SVG-TV News for Tuesday, January 18th, 2022. I am Rochelle Batiste with the details. SVG on Monday, January 17, 2022, recorded another COVID-19 death. The latest victim is a 90-year-old male who tested positive for COVID-19 on January 10th and was admitted to the isolation ward at the Milton Cato Memorial Hospital and died on Monday, January 17th of COVID-19 pneumonia. The patient was unvaccinated. His death brings the death toll from COVID-19 to 88. Meanwhile, one new COVID-19 positive case was reported from 6 samples collected on Saturday, January 15th, resulting in a positivity rate of 16.7%. 56 new rapid antigen positive results were also reported on Saturday from flu clinics. 3 new COVID-19 positive cases were reported from 5 samples collected on Sunday, January 16th, resulting in a positivity rate of 60.0%. 28 new rapid antigen positive results were also reported on Sunday from flu clinics. The Health Services Subcommittee of the National Emergency Management Organization, NEMO, said the current COVID-19 testing algorithm based on the WHO recommendations appropriate for this phase on the current outbreak reduces the number of RT-PCR tests conducted, relying more on rapid antigen and clinical diagnosis. There are currently no patients admitted for COVID-19 at the Argyle Isolation Facility. 22 patients, however, were admitted to the COVID-19 ward at the Milton Cato Memorial Hospital, 5 of whom are vaccinated, 1 partially vaccinated, and 16 unvaccinated. 29 recoveries were noted over the reporting period. 878 cases are currently active, and 88 persons with COVID-19 have died. 6,604 cases of COVID-19 and 5,638 recoveries have been recorded in St. Vincent and the Grenadines since March 2020. St. Vincent and the Grenadines has been deemed as the most vaccine-hesitant country in the sub-region. This is according to the Vaccine Hesitancy Index tool used in a study commissioned by UNICEF and UNICEF and conducted by the Caribbean Development Research Services, CADRES. The study, conducted in October and November last year, was also done in Dominica, Barbados, Grenada, St. Lucia, and Trinidad and Tobago. Larissa Pugsley-Kidd tells us more on the findings for SVG in this report.
19 Vaccine Hesitancy Report 2021 pointed out that SVG was the only country the survey was conducted not using face-to-face due to extreme challenges with COVID-19, which made in-person interaction very difficult. However, the report stated that the reasons for an early hesitancy involved a lack of trust in the vaccines on account of the speed of their development and uncertainty over long-term side effects. The major factors that convinced the respondents to get a vaccine themselves were doing more research and speaking to their doctor. According to the survey, the primary sources of information on the COVID-19 vaccine situation were government officials, sourced by a wide margin. St. Vincent and the Grenadines was the only country where social networks were the priority medium of communication. In terms of whether the use of local and international personalities has any effect, vaccinated respondents in St. Vincent and the Grenadines, 75%, were the most likely to find this useful. The all-country average was 62% in this category. Most vaccinated respondents believe in a vaccine mandate for a wide range of people, except primary school students. Only 33% thought vaccines should be mandated in this group. The chief reason given by respondents for avoiding vaccination is the contention that they don't trust it and are unsure about long-term side effects. The survey showed that an unvaccinated person in St. Vincent and the Grenadines is under 50, could be either male or female, does not work in an institutional environment, and is educated to secondary or post-secondary level. When asked if their views on taking a vaccine changed over time, 65% of the unvaccinated said no, and 24% said they were actually now less inclined to get vaccinated. Only 11% said they were more inclined to do so. The preferred mode of communication for unvaccinated persons was Facebook, followed by WhatsApp. According to the survey, the sources that respondents relied on to inform their decision to remain unvaccinated were social media and government official sources. The survey also sought to find if there was any evidence that would make reluctant respondents take a COVID-19 vaccine. Most said more information on side effects and efficacy could sway them. When asked if there were any other factors that might help change their minds, apart from more medical information, respondents suggest they might get vaccinated if it is required to overseas travel or to get or keep a job. Despite remaining unpersuaded, around 70% of the unvaccinated in St. Vincent and the Grenadines found the information conveyed by personalities to be helpful. In relation to vaccine mandates, unsurprisingly, unvaccinated respondents were much less likely than their vaccinated counterparts to support them. Agreement with mandates for students was particularly low. The recommendations from the survey are that communication strategies need to speak to key concerns, target the demographic profile of the unvaccinated, and hone the use of non-governmental personalities and influencers. Supplemental strategies should consider the risk to vulnerable groups and, in respect of younger and unemployed persons, consider promoting infotainment products that might reach this audience. Vaccination tracking is necessary to determine if strategies are working, and is therefore suggested that this exercise be repeated in another year if the issue continues to be relevant. Reporting for SVG-TV News, Larissa Poxley-Kidd.
And in a bid to assist SVG and other Caribbean countries address vaccine hesitancy, the U.S. government has recommitted itself to help the Caribbean tackle COVID-19. We hear more in this report from GBN Television.
Deputy Chief of Mission in the U.S. Embassy Barbados, David Shiner, has renewed the U.S. government's commitment to assist the Caribbean in the fight against COVID-19. He was speaking at a virtual press conference last Friday to present the findings of a survey on COVID-19 vaccine hesitancy in the Caribbean.
Since May 2020, the United States government, through USAID, has supported the Eastern Caribbean region, the Bahamas, Guyana, Suriname, and Trinidad and Tobago with $7.5 million of assistance, of which $2.5 million came from the American Rescue Plan for Vaccine Readiness. In partnership with governments and stakeholders, the United States is committed to assisting Caribbean countries to overcome vaccine hesitancy. We are proud to work with our partners gathered here today to achieve this goal.
The survey conducted in Barbados, Dominica, Grenada, St. Lucia, St. Vincent and the Grenadines and the Trinidad and Tobago will now create a solid foundation in implementing plans and programs to enhance their fight against the dreaded COVID-19 virus, attracting more confidence in the vaccination process.
In a late 2021, U.S. Embassy Bridgetown hosted a Facebook Live event to combat COVID-19 vaccine hesitancy, inviting the people of Barbados and the Caribbean to ask questions of respected public health professionals. What we learned correlates closely to the data gathered from the vaccine hesitancy survey today, which in the Caribbean region, as you know, is mainly rooted in individual concerns about the safety of the vaccines, includes misconceptions and misinformation about the secondary effects of the vaccines. Fighting this pandemic will take significant resources and an urgent collective effort among governments, civil society, private sector, multilateral organizations, and international partners. A coordinated approach like the one we're taking is critical up to an equitable uptake throughout the region and to muster the speed needed to get ahead of concerns that are driven by an unvaccinated population.
And Chief Medical Officer Dr. Simone Kiza Beach is urging people to be extremely careful at this time as the Omicron variant continues to spread on island. The CMO said vaccinated people shall also take heed of this and comply with all of the protocols.
Careful. So we all need to be, whether we are vaccinated or not, we need to be very careful. If we are vaccinated, we do have some reduced vulnerability to severe disease and death. That's not disputed. But what needs to happen is that even though you're vaccinated, and especially if you are greater than 5 months since your last dose of your vaccine, you should be extremely careful in terms of, wearing your N95 mask. Well, actually, everybody should be wearing an N95 mask now, or a double mask at least. But what we're saying is that unvaccinated people with Omicron are still more likely to become significantly ill and die.
And Dr. Keza Beach noted that admissions at hospitals has been closely monitored.
The second thing I said there about admission is extremely important in terms of preserving our healthcare system, because as it is now, I'm not sure if persons remember, we went into December with relatively few persons being admitted, and in just one weekend, the weekend between the 21st, 29th into the 4th, we had about 7 admissions, and we have continued to have admissions. And also we realized we had about 3 deaths over the last few weeks. So the difference is significant still. And what we're urging is that, yes, everybody should get your boosters as quickly as possible, and they're all available.
Meanwhile, the CMO expressed dissatisfaction with the disregard for COVID-19 protocols during the recent holiday season.
In the first week, in the week of the 26th of December, persons started blaming these vaccinated events and saying they were the cause. But as I've said before, when persons went to a vaccinated event on the 26th, and by the 27th, the Monday, they were having symptoms and they were positive, that meant that persons went into these events. And it's just reinforcing that this is most likely they went into the event with Omicron. And we do have documentation from CAFA that some of those persons who have a history of being in some of these events did indeed have Omicron, okay? So, but we have to look at where did they pick it up first. And we think about the crowds in town, the mask under the chin, the crowds in Heritage Square, let me say it clearly, and so many of these other bars, restaurants, nightclubs that have been operating in clear disregard and, blatant disregard for the recommendations, for the that you should not be having all of these people in your place en masse.
Japanese ambassador to CARICOM, His Excellency Taosuo Hirama, who is on a 3-day visit to SVG today, met with Prime Minister Dr. Raul Gonzalez, after which he was taken on a tour to the windward side of the island. His first stop was at the Bible Learning Resource Center, which is still being used as a shelter for volcano-displaced persons. The ambassador on the touring delegation then moved further up north to the new site for the Louis Burnett home in Orange Hill, where a small ceremony was held to kickstart works on the rehabilitation of the facility. The Japanese ambassador also visited Sandy Bay, one of the communities in the red zone recovering from the eruption of La Soufrière volcano. The government of Japan, in partnership with the government of SVG and the United Nations World Food Programme, collaborated on the national response to the volcanic eruptions in April 2021, providing emergency logistics support and technical assistance and resources for cash and voucher assistance to displaced persons from the red and orange zones through the Soufrière Relief Grant. The International Organization for Migration, IOM, UN Migration, is also providing support to SVG in its recovery efforts. And through partnership with the government of Japan, NEMO, the Ministry of Education, and the Ministry of Health, the IMO is supporting the management of the emergency shelters that are still in use, the repairs of washrooms in 21 schools on the mainland, and retrofitting the Louis Burnett facility in Orange Hill into a welcoming, safe and eco-friendly home for 40 senior citizens. Ambassador Hirayama will end his 3-day visit to SVG tomorrow, Wednesday, January 19th, 2022. With about $250 million in losses in tourism over a 2-year period, the Ministry of Tourism is looking at ways to not only bounce back from the economic fallout, but to transform the local industry to the benefit of all stakeholders. Contributing to the 2022 budget debate in Parliament last Friday, Minister of Tourism and Culture Carlos James said the Caribbean region is showing the greatest potential for quick recovery, and SVG has to position itself to do likewise. as tourism remains a key driver of the country's economic growth. James said this year they will be focusing a lot on domestic tourism and encourage incentives to support the local industry.
Because every dollar you spend, whether it's on a day park in your vehicle and booking a taxi, or going to a local restaurant to dine, or a weekend at a local hotel or resort, or booking a kayaking trip or a trip with a tour guide to one of our many beautiful tourism sites, is putting $1 in the pocket of someone in the industry who was able to then put food on their tables to provide for their families. And it's very important that we encourage and recognize that.
James said they will also be putting renewed effort in promoting SVG as a premier wedding destination, and it is their intention to bring to Parliament soon amendments to the regulations relating to the Marriage Act to facilitate the smooth processing of same-day license relating to destination weddings, which is now a big thing. The tourism minister said it is important that the people prepare themselves for the overall transformation of the industry, especially on the mainland, noting that focus will also be placed on training and building capacity.
Right now, their hotels were short of workers. Not enough workers are being trained in the hospitality services. There will be a time when these workers will be working on shifts, some coming off at midnight. It means that our mode of transportation, in how we commute, both passengers who are visitors and also workers, will have to change. Bus routes will have to change. The time in which buses come off the road. The transformation that is coming to nightlife, entertainment. What this country is going to experience in the next 2 to 3 years. And we have to prepare ourselves for that. It's that total transformation in how we do things and provide services on mainland St. Vincent and the Grenadines.
And the Ministry of National Mobilization will continue to work on the social policy framework and the draft National Disability Act this year. This is according to Minister Randy Brewster, who told Parliament during his contribution to the 2022 budget debate that he is excited about the legislation which will bring to the forefront the disabled population, taking into consideration their ease of access and creating employment opportunities for them.
Madam Speaker, I had an encounter recently that really took a toll on me, because I met with a gentleman who was disabled, and he only wanted to, he said, I don't want poor relief, I don't want no assistance, I just want something to do. You know, so this piece of legislation will take into consideration, you know, employment for those who are disabled. It's a really good piece of legislation, and I'm looking forward to seeing the implementation in the year 2022.
Minister Brewster said they will also be looking at the elderly care and protection bill this year.
When the volcano erupted, and you heard the Honorable Prime Minister mention it, a lot of our elderly were left abandoned in some of the shelters. Madam Speaker, we have to hold some of the family accountable for these things. We need to put legislations on the book that would help to care and protect our elderly. Madam Speaker, at this point, you know, there were 2 different centers that the government had to bring on board just to help with the care for the elderly. And you don't hear these things, you know, but it is the same government that took on extra home helpers because of what was happening to our elderly And for the development of this piece of legislation, we made a curtain call to our neighboring islands. And I'm happy to say that thus far, we are working with Trinidad and Tobago has submitted their policy so that we can get some insight as to how we can craft this piece of legislation going forward.
Over 30 million EC dollars have been allocated to the Ministry of National Mobilization in the 2022 budget. And the 2022 budget amounting to 1.3 billion EC dollars was passed in Parliament on Friday, January 14th. Today, SVG-TV News spoke with some people in capital Kingston to get their views on the budget and the debate. The majority of those our news team spoke with admitted they did not follow the proceedings, and those who did are unsure about what is inside of the budget for them.
Speaking, I don't really have no comment about that because I didn't really think about it that seriously. So what I'm saying, I need to hear more information about it so I can know what will be benefit for me and for others as well.
I don't really know anything. I don't really know anything as yet, so I can't really say.
But you would usually listen?
Yes, ma'am.
This is what you see going on in St. Vincent. I don't know what's going on here. Everybody with their own kind of styling going on here, I don't know. I don't take part in this kind of thing in St. Vincent because one man will rule the country.
Volcano and the pandemic still managed to struggle through. Or see some countries still was struggling to pay civil servants, their civil servants' salaries. I know. Whereas we go through worse disaster than other countries, pertaining to the hurricane, the pandemic, and the sulfur, the volcano, and still struggle to push through. And still, at the end of the day, we still here. We still salaries are being paid, and people could do the move around. Yes, it wouldn't be perfect, but I think it's all right.
I listen to some part, but mostly was on top the phone.
And some of the persons said they learned of ministers testing positive for COVID-19 from others, but generally they were not in tune with what took place.
Didn't watch, so I don't know really what's going on. I've just been hearing certain things, but then didn't hear for myself, so then I might not go along with what everybody says without hearing for myself or seeing for myself. So wedding that they went, and then it broke out, and then they went parliament the week, I think it was the Monday, and stuff like that. But I think if they're saying that they're supposed to be vaccinated, fully vaccinated, so it's hard to understand.
The country even got it. Who is me and you and other people to say? So you can't say it's a people thing, and the head society people, the leaders of the country, who is also the ministers as well, despite the Prime Minister didn't have it, but God forbid he doesn't get it, and others, and the opposition leaders, the opposition leader and the opposition side. It is real. It is real.
To me personally, to me listen to anything is a bunch of fraud and promises and anything. And most of the time I listen to anything like in school is most of the things they say they ain't going to do in the budget, they never fulfill it.
In some police news now, a 19-year-old student of Glen was arrested and charged with possession of an illegal firearm, 2 counts of possession of ammunition, taking of convenience, and handling stolen goods. The accused allegedly had in his possession 1 black firearm, make and serial number unknown, without a license issued under the Firearm Act. He was also charged for having in his possession 3 rounds of .9mm ammunition and 3 rounds of .38 ammunition without a license issued under the Firearm Act. In addition, addition, he was charged with having one black Racer 150cc scooter registration plate PH91, knowing or believing it to be stolen, did receive same for his own benefit. He was further charged with taking motorbike PH91 without the consent of the owner or any lawful authority. The incident occurred in Glen on Thursday, January 13, 2022. The accused appeared before the Kingston Magistrate Court on Monday and pleaded not guilty to all charges. He was granted bail in the sum of $6,500 EC with one surety and is to surrender all travel documents. The firearm-related matters were adjourned to the Serious Offences Court and the other matters were adjourned to the Calico Magistrate Court. The student is to report at the Calico Police Station every Wednesday between 8 a.m. and 8 p.m. until all matters are disposed of. And the police have arrested and charged Lyndon Bino of Old Montrose with the offense of wounding with intent. The accused allegedly unlawfully and maliciously wounded a 52-year-old tailor of the same address by cutting him on his throat, left thumb, left index, and left middle finger with a cutlass with the intent to do so at Old Montrose on July 20, 2021. Bino appeared before the Kingston Magistrate Court for arraignment. He was granted bail in the sum of $6,000 EC with one surety. He was also ordered not to have any contact with the complainant. The matter was transferred to the Serious Offences Court and should have been heard today.